Good evening, I'm Dennis Ward. Welcome to APTN National News. Most media outlets in Quebec are still buzzing about Premier Francois Legault's recent announcement about gradually lifting the province's COVID restrictions. But our correspondent, Lindsay Richardson, has kept one ear to the ground to keep tabs on the Echaquan Commission, looking into the death of Joyce Echaquan, the Atikamekw mother who live-streamed her hospital staff hurling insults at her shortly before she died. Lindsay joins us now from the Montreal Bureau. Lindsay, thanks for being with us. Lots of info to unpack here. What's it like trying to keep up?
Well, Dennis, there are two real considerations to have here. On a personal level, 8 months have passed since Joyce Echaquan died, but this is still a very raw memory for the people that it touches directly. So listening to them revisit the night she died, revisit how she, was really a sunny presence in their lives prior to that night is difficult. But on the other hand, as a journalist, there's a lot of technical considerations to have here. And if we compare it to other commissions we've seen in Quebec, it's not as accessible as we would have hoped. The testimony is not the recordings of the testimony are not accessible after the fact. There are no transcripts available. There's no simultaneous translation from French to English. And not only that, a lot of the information that's being presented is protected by not one, but two separate publication bans. So it's easy to understand that there is an intense public interest in this case, and people want analysis and up to the moment, updates about what's being said and by whom. But it's proving to be a bit of a challenge, bringing the information forward in a concise way, in a timely way, and most importantly in this case, in a correct way.
Absolutely. Well, that said, we're hearing that there was some big drama in the courtroom today.
Yeah, so the first week of testimony, we heard from the family, about what happened, how Joyce was brought to hospital, what were they informed of, after the fact. And this week we moved to the medical perspective, so hearing from the healthcare workers at Joliet Hospital. And today in particular, we heard from the nurse who is seen in the video that Joyce live streamed to Facebook, the one who picked up the phone and who stopped the recording and deleted it out of a panic. So she testified today, very emotional. Really wanted to get across the fact that she is contrite about what happened. She blames the environment at the hospital, obviously the stress of the pandemic, and says that she essentially blacked out. She didn't realize what she was saying in the moment until she saw the video after the fact. So that's one segment of drama from this morning. And after that testimony, a lawyer actually asked for a private audience with the coroner. And about 5 to 10 minutes later, the coroner announced to the open courtroom that the healthcare workers who have testified so far in open court, their names protected by a publication ban, are still receiving death threats, and death threats serious enough that the provincial police are actually now investigating them. So if you can imagine, this is just a snapshot of one day in this commission that's been going on for almost 7 and still is going to go on for another 2 weeks. So a lot of curveballs to account for.
Absolutely. Lindsay, have we learned anything new about Joyce in this process?
So, Dennis, it's really interesting. What we're dealing with right now are actually dueling portraits of Joyce. So in the first week, we heard about Joyce described as the mother of a community, the mother of 7 children, the love of Carole Dubé's life, really the light of her community and a representation of the Atikamekw Nation as a whole. And then here, this week, we're learning more about Joyce as a hospital patient. So Joyce, who had quite a few what we call comorbidities, so extensive heart problems, type 2 diabetes, and most importantly, it was discussed this week that she may have had a narcotics dependency that would have kicked off with a doctor's prescription at some point in the recent past. So the healthcare workers who testify claim that Joyce was agitated from the start when she arrived at the hospital, that she was demanding morphine, and that's actually a direct contrast to what we heard at the beginning, the rumors that she was allergic to morphine and may have been injected purposely. So a lot of information coming out, hard to make heads or tails of it here. It really is a bit of a perfect storm situation, a lot of moving pieces to consider.
What about the hospital itself? What more do we know there?
So pretty much everybody who's testified so far, they were asked directly about whether they received cultural sensitivity training, and across the board they said no. Most of the healthcare workers there only received a 3-hour online workshop to sensitize them to Indigenous realities. We don't know anything about who was leading those workshops or what was covered or if there was any follow-through after the fact. So hopefully the situation is going to change. Shortly after Joyce died, Minister of Indigenous Affairs actually announced a big financial investment in this area, mandating cultural sensitivity training for healthcare workers at Joliet or in communities serving the Atikamekw Nation. Again, we don't know much about who is going to be leading those or what the follow-through is going to be, but the impression we get is that these nurses are dealing with a high volume of patients, they're understaffed, they're stressed, and in the words of the nurse who testified today, at times they're forced to work like slaves, and they believe this contributed to the care that Joyce received.
Part of the inquiry's focus is getting answers, but what kinds of questions are coming up as it plays out?
So this is something that I actually have just learned. This is my first coroner's inquest, and my impression at first was that the coroner is there sitting in essentially the director's seat and watching the scene play out between the witnesses and the lawyers who are charged with questioning them. I did not know that she can cut in and essentially ask questions herself and try to fill in informational gaps as she identifies them. So this is called an enquête, so translated to investigation. So it's an investigation in an investigation. This has happened twice in the last week. It happened on Monday after hearing from both the emergency room doctor and the gastroenterologist who cared for Joyce, and came out that there's essentially a 2-hour chunk of time where it's unclear which doctor or medical service was responsible for her care. So Gehan Kamel, the coroner, put out an appeal to Joliet Hospital. She wants all of the records that state very clearly the chain of care in Joyce's case. And then again today, she came out and reacted to this continuous narrative about Joyce seeking morphine. She wants a year's worth of Joyce's hospital charts, and she wants hard evidence and hard notes that indicate that Joyce presented at hospital to seek medication. And she also made the distinction that it's very different when a patient goes to hospital seeking care for pain and is given a prescription for medication, and when a patient shows up in withdrawal or in alleged withdrawal demanding medication. So as things kind of unfold, we're seeing contradictions, but for the most part the coroner seems to be on the ball, making sure that everything is laid out in as clear of a fashion as possible.
Lindsay, lots going on here. We'll have to leave it there, but appreciate your coverage of this and filling us in on it today.
Thanks for having me, Dennis.
To politics now, and for the Assembly of First Nations, this is an election year. Current National Chief Perry Bellegarde has announced he will not be seeking re-election, so the position is up for grabs. This year's nomination process is still open, and there may be a number of women stepping up to take on the challenge. Jamie Pachagumscum spoke to one of those potential candidates today.
Thanks, Dennis. Today I spoke with Dr. Kathy Martin of the Listigouche First Nation in Quebec. She announced her candidacy on social media. She has 20 years of political experience on the community and grassroots level. Nationally, she recently worked out of Ottawa for nonprofit organizations. She has also worked with the First Nations Health Management Association as an education specialist, delivering management workshops throughout the country. And she has a doctorate in curriculum leadership development.
Frameworks are my specialty, and so how do you respect the diversity of each independent nation, because we are independent nations, while addressing the issues that have been instilled upon us? And I say these issues are instilled upon us because we all face the commonality that we were, at the mercy of the federal government who, implemented, Indian Acts. They implemented legislation that with the blanket and Band-Aid approach for us all, but yet we are diverse and unique independent nations.
If elected as National Chief, Martin would be the first woman to hold the position. While she doesn't want others to view her gender as her defining characteristic, she did point out that many First Nations are matriarchal, and having a woman in that position would bring a different viewpoint.
That being said, an Indigenous woman perspective will come with a different kind of perspective because traditionally women are more compassionate and caring, and they think more along those lines, whereas males tend to think more analytically.
Because of COVID-19, this year's elections are going to be held virtually. So this could pose a challenge to First Nations communities without a reliable internet or phone connection. The nomination process says candidates need 15 nominations from First Nations chiefs. Martin says she's having difficulty finding all 15 through this online process.
If there were a forum that were provided like in the past, where like all chiefs assembly, where you can go as a proposed candidate, you could talk to these people in person, and it's much more personal. You can get a lot more said. Other people are able to listen, so it's much more effective. I have to say it's really a struggle with the virtual pre-campaign elicitation of nominators.
So far, the only other confirmed nominees for candidates are Grand Chief Alvin Fiddler of the Anishinaabe Nation and Jody Calahoo Stonehouse of the Michelle First Nation in Alberta. APTN will be bringing you more profiles of candidates as they become available. The nomination process ends June 2nd. Jamie Pashigumskam, APTN National News, Ottawa.
Thanks, Jamie. And just moments ago, outgoing Ontario Regional Chief Roseanne Archibald announced she will be running for National Chief of the Assembly of First Nations. Archibald plans to officially kick off her campaign next Tuesday. Time now to step aside for a quick break. Still to come, we'll check in on the COVID situation in Nunavut. Stay with us. Welcome back to Nunavut now, where the capital, Iqaluit, has been under public health restrictions for more than a month due to a COVID-19 outbreak in the city. Joining us from Iqaluit is our Kent Driscoll. Ken, thanks for being with us. How are the numbers looking there today?
Thanks for having me, Dennis, and there's some glimmer of hope in today's numbers. We have 55 active cases of COVID-19 in Nunavut today. 54 of them are here in Iqaluit. Now, there were 2 new cases reported today and 10 people reported as recovered. And that's been the trend all week. New cases almost every day, but more people who have recovered than were getting new cases. As well, today, Iqaluit City Council announced that the Red Cross has arrived to help out. The first thing they're going to do is help staff Iqaluit's men's shelter. People on the staff have been forced to isolate it out after being potentially exposed to COVID, and you can't run that shelter without staff.
So are they really feeling a pinch over at the men's shelter then right now?
Well, that's really what's happening, and it's that all the sort of social safety net things all over town is showing us how thin our safety net is. Like, look at food security here. We have a food center, and they operate a daily meal program, and it feeds about 200 people a day. Now, yesterday, it was feared they would have to close after one of their staff members tested positive for COVID-19. They managed to get the rest of the staff tested, and it was all negative, and they're now open. But if it wasn't for the Frobisher Inn stepping up yesterday and feeding those people, that would have been 200 more hungry people here in Iqaluit. The same goes for our schools being closed. The schools in Iqaluit have food banks, and they feed many hungry students every morning. Now, individual teachers in schools are trying to set pickup times for food or send food home with schoolwork, but it is hurting people in the community. And then again, as far as our safety net goes, everything gets flown in, and now cargo has been delayed for weeks and weeks now. Canadian North's been very backed up. Their own staff have had COVID-19, both here in Ottawa. Right now, they're doing most of their shipping. Instead of shipping from Ottawa, they're shipping from Hamilton. The grocery stores, we've been lucky. The grocery stores have been able to stay open, but with people being forced to isolate because of potential COVID-19 exposure, they don't know how many staff are going to show up in a given day. So it's been a real challenge, Dennis.
No kidding, and like you mentioned, people stepping up, even private businesses. How do people feel the government of Nunavut has handled this latest wave?
Well, the political end's about to get really interesting in the next week or so. The Nunavut Legislative Assembly is scheduled to come back next week. Sort of. What they're going to do, there are travel restrictions in place to and from Iqaluit, so they're going to try and do the session with a number of the MLAs remote from their home communities. That's a group of people in one of the country's worst served zones for internet, trying to video conference between multiple locations with simultaneous interpretation. That's got the potential to go pretty sideways. And then when you throw in the idea that we have a territorial election coming in October, it's going to be a very interesting session at the Assembly. Almost anything could happen.
No kidding. Sounds interesting. In terms of the medical side of things here, Kent, tests, vaccines in the arms, how's all that going?
Well, everyone here in Iqaluit, we all owe a debt to our public health workers. Dr. Michael Patterson, our Chief Public Health Officer, sort of explained it yesterday at a briefing. We're getting 100 people a day vaccinated here in Iqaluit, and the staff, they're working 6 days a week, 10 to 12 hours a day. Now, that's not sustainable over the long term. But the testing's improved vastly in the last year. Most of our tests, it's a 24-hour turnaround. We find out pretty quickly if we've got a positive. But the biggest change coming, the potential to vaccinate teens. Nunavut has Canada's youngest population. So even if every adult in the territory took the vaccine, we have so many youth, we would have a lower percentage of people vaccinated than any other region in the country. So the idea that vaccines for teens are going to be coming off the plane for the more than 4,000 teenagers here in Nunavut, that's a pretty big deal.
No kidding. Good news indeed. Hopefully everybody gets those shots in the arm soon. Kent, appreciate you taking some time for us here today. Stay safe.
You stay safe too, Dennis, anytime.
To hockey now, and as you likely know, the NHL playoffs are finally underway. Fans can't go to the games in person just yet, but that hasn't stopped some hardcore fans of the Edmonton Oilers from cheering on their team. APTN's Chris Stewart talks to Oilers superfan Magoo and friends.
Millions of hockey fans in Canada have been waiting for this moment. After another NHL regular season, the playoffs are starting with the teams in the Northern Division, and the Edmonton Oilers are playing the Winnipeg Jets in round one. Superfan Magoo has been outside Rogers Place for every Oilers game this year. Now he's excited to be cheering on his team with his friends.
What we're doing is we're pumping up the team as they go into the building. Since we can't be inside Rogers, we're outside here pumping up the city and getting the team ready for game one of the playoffs.
Superfan Magoo says he's expecting to see a great rivalry.
It's going to be exciting. It's going to be back and forth. You're going to see nothing but speed. You're going to see skill. And most importantly, you're going to see some awesome hockey.
About a dozen die-hard fans were in front of the arena to pump up the cars driving by.
We are here to support the Edmonton Oilers. Can you see we're all getting all hyped up for the game? Let's go Oilers!
This year they're going to win the cup. Because they got McDavid, they got Ethan Bear, they got Draisaitl.
I asked Superfan Magoo for his prediction.
Oilers in 6.
The game was close until the end, with the Winnipeg Jets getting first blood, winning the game 4-1. Game 2 starts in Edmonton, May 21st. And the Montreal Canadiens play the Toronto Maple Leafs for the first time in 42 years, starting Thursday. Chris Stewart, APTN National News, Edmonton.
Wonder how superfan Magoo feels about that Jets win last night. Still time to do it in 6, though, for the Oilers. I'm looking forward to the Leafs winning tonight. Time for another quick break, but stick around. Coming up, a preview of tonight's Nation to Nation, featuring a showdown of Canada's UNDRIP bill. Welcome back. It was a wet, cold day out there in Winnipeg. Let's take a peek at what tomorrow's weather forecast is looking like. Starting on the East Coast, 19 with showers for St. John's, 21 in Halifax and Charlottetown, 6 in Nain, -1 for Inukjuak, 30 in Montreal, showers, and 24 for Chibougamau, 26 and rain in Sault Ste. Marie, 27 for North Bay, 24 and rain in Thunder Bay, much cooler, 15 and showers in Sioux Lookout, 5 in Churchill, 4 in God's Lake. 16 with rain for Winnipeg, 8 and showers for Dauphin. 5 with rain for Regina, a chance of snow, and 6 in Saskatoon. 7 in Uranium City and the Ronge. Over in northern Alberta, 16 in Fort McMurray, 19 in Peace River. 5 with a chance of snow in Medicine Hat, 2 and snow in Lethbridge. Sunny and 18 for Vancouver, 21 under the sun in Victoria. 14 with showers for Dease Lake, sunny and 19 in Prince George. 20 in Old Crow, 10 with rain for Whitehorse. 12 and sunny for Yellowknife, 20 under the sun for Wrigley. -1 in Sax Harbor, +6 and sunny in Pawatuck, 20 in Inuvik. On this week's APTN Investigates, John Murray visits a Tunaka man living in Fort McMurray, Alberta, who says he has had enough with the lack of accountability in some First Nations. And Chief Terry Paul talks about Member 2's success and their secret formula. Here now is a look at For Trust or Profit, Part 2.
Rob Louie is the founder of a group that helps band members fight for accountability.
Band council corruption is real. Let's be very clear about that. It is real. But does it happen everywhere? No.
Rob's uncle, Wayne Louie, took on council in his home community, Lower Kootenay, British Columbia, over questionable payments to chief and council. In 2015, the BC Court of Appeal gave Wayne Louie a victory. The court ordered the chief and band councillors to return a cash bonus they'd given themselves for completing a land claim. Because the court said council has a fiduciary obligation to the band members.
That case is the leading authority on band council fiduciary duty in relation to band monies.
A fiduciary duty means the chief and council must put the best interest of community members before their own interest when dealing with band-held money. It's about trust.
The buck stops with the chief and council. The chief and council are responsible, for what happens in our community.
Terry Paul has been chief of Member 2 for 37 years.
I just wanted to move our community out of economic depression and poverty.
Well, in case you've forgotten like me, it's Thursday, and that also means our political show Nation to Nation is up next. Host Todd Lamoran tells us how they did something a little different this week.
This week we're going to have a debate about Bill C-15. That's the proposed legislation that will make Canada's laws comply with the principles of UNDRIP, the United Nations Declaration on the Rights of Indigenous Peoples. On the one hand, former NDP MP Romeo Saganash, who supports it. He, of course, tried to pass a private member's bill on UNDRIP 2 years ago. And on the other is policy analyst Russ Diabo. He says it's a bad bill and it's just another exercise in colonialism. I'll also talk to Conservative MP Jamie Schmale. The Conservatives have long argued C-15 will give Indigenous communities a veto over resource development. That's all coming up in a matter of minutes.
Looks like a must watch. That's all the time we have. Have a good night. Todd's next.